Chapter 20, Evaluation. Evaluation is the final step of the nursing process. In this step, you determine if your patient's condition, or well-being, has improved. Nurses conduct evaluation measures to determine whether they have met expected patient outcomes, not whether their nursing interventions were complete. Expected outcomes are the standards against which the nurse judges whether goals have been met and care was successful. Critical thinking in evaluation. Critical thinking is the key to evaluation. You have previously learned that clinical decision-making is complex, requiring flexibility and the ability to know and recognize subtle changes or aspects of a patient's condition. Yuan et al. Identified 4 indicators that reflect a nurse's ability to perform evaluation. Number 1. Examine the results according to clinical data collected. Number 2. Compare achieved effect with goals and expected outcomes. Number 3. Recognize errors. And number 4. Understand a patient's situation and self-reflection, and correct errors. These indicators show that the evaluation process is comprehensive. It requires more than making a quick check of a patient to be sure that he or she is stable, or without further problems. It is a methodical approach for determining if nursing implementation was effective in influencing a patient's progress or condition favorably. Shown as Figure 21, Critical Thinking and Evaluation. Examine results. Evaluation is an ongoing process that occurs whenever you have contact with the patient. Once you deliver an intervention, you continuously examine results by gathering subjective and objective data from a patient, family, and healthcare team members. Tanner calls this reflection in action. For example, a nurse is able to read a patient by reviewing assessment data and determine how the patient is responding. At the same time, you are reviewing knowledge regarding a patient's current condition, the treatment, and the resources available for recovery. By reflecting on previous experiences caring for similar patients, you are in a better position to know how to evaluate your patient. You can then anticipate what to evaluate. The effective examination of results requires you to have an open mind, keen observation skills, and the ability to exhibit a neutral perspective. Do not form a judgment about a patient's progress or response without gathering data pertinent to the healthcare problem. Be thorough in gathering all clinical information needed to adequately evaluate a patient's condition. During planning, a valuable resource for selecting outcomes is the Nursing Outcomes Classification, or NOC. The purpose of NOC includes the following: 1. To identify, label, validate, and classify nurse-sensitive patient outcomes. 2. To field test and validate the classification. And 3. To define and test measurement procedures for the outcomes and indicators using clinical data. For each outcome, there are specific recommended evaluative measures, called evaluation indicators. For example, the patient's physical condition, behaviors, or perceptions that are measures of outcome achievement. Please review the following as a supplement to this PowerPoint. Table 21. Evaluative measures to determine the success of goals and expected outcomes. Table 22, self-management evaluation, and Table 23, linkages between nursing outcomes classification and nursing diagnosis. Compare achieved effect with goals and outcomes. The nurse should compare clinical data, patient behavior measures, and patient self-report measures, collected before implementation, with the evaluation findings gathered after administering nursing care. If outcomes are met, then the overall goals for the patient were also met. Critical thinking directs you to analyze the findings from evaluation. Ask, has the patient's condition improved? Is the patient able to improve, or are there physical factors preventing recovery? To what degree does this patient's motivation or willingness to pursue healthier behaviors influence responses to therapies? As a rule of thumb, when you achieve outcomes, the related factors for a nursing diagnosis usually no longer exist. Shown as Figure 20-3, Critical Thinking in the Evaluation Process, an example on how to compare achieved effects with goals and outcomes. Miyoko is a nursing student assigned to Mr. Mashoud, a 48-year-old Arab admitted to the hospital with kidney stones. Upon Mr. Mashoud's admission to the emergency department this morning, he was experiencing excruciating pain. The treatment plan for Mr. Mashoud includes keeping him in the hospital until he passes the stones, and adjusting his pain medication as needed. Miyoko evaluates Mr. Mashoud's response to the medication therapy to update his care plan. Miyoko assesses Mr. Mashoud's pain before NSAID administration, and again approximately 1 hour after administration. Question: Miyoko knows that evaluation is a blank process that occurs whenever contact with a patient occurs. The answer is ongoing. Interpreting and summarizing findings. A patient's clinical condition often changes during an acute illness. In contrast, chronic illness results in slow, subtle changes, although acute exacerbations can occur. By applying your clinical knowledge and experience, you recognize complications, or adverse responses, to illness and treatment in addition to expected outcomes. Always make clinical judgments on the basis of your observations of what is occurring with a specific patient, and not merely on what happens to patients in general. Evaluations are patient-specific, made on the basis of a close familiarity with each patient's behavior, physical status, and reaction to caregivers. Comparing expected and actual findings enables you to interpret and judge a patient's condition and whether predicted changes have occurred. The nurse should perform the following steps to objectively evaluate the degree of success in achieving outcomes of care. 1. Examine the outcome criteria to identify the exact desired patient's behavior or response. 2. Evaluate a patient's actual behavior or response. 3. Compare the established outcome criteria with the actual behavior or response. 4. Judge the degree of agreement between the outcome criteria and the actual behavior or response. And 5. If there is no agreement, or only partial agreement, between the outcome criteria and the actual behavior or response, then ask, what are the barriers? Why did they not agree? The accuracy of any evaluation improves when you are familiar with the patient's behavior and physiological status, or have cared for more than one patient with a similar problem. Evaluate each expected outcome in its place in the sequence of care. Recognizing errors, or unsuccessful outcomes. Nurses must have an open mind, actively pursue truth, be very patient and confident, and engage in self-reflection. They must apply observational skills, critical thinking, intellectual standards, and knowledge to recognize the actual results of care. Reflection in action typically occurs when there is a trigger event. The trigger often involves a breakdown, or perceived breakdown, in practice. It involves a nurse's ability to recognize how a patient is responding, and then adjusting interventions as a result. Patients with the same healthcare problem are not treated the same way. As a result, you sometimes make errors in judgment. The systematic use of evaluation provides a way for you to catch these errors. By consistently incorporating evaluation into practice, you minimize errors and ensure that a patient's plan of care is appropriate and relevant, and changes according to met and unmet needs. Reflective reasoning improves the accuracy of making any diagnostic conclusions. Reflection lessens the likelihood that reasoning is based on assumptions or guesswork, and increases the likelihood that it is based on objective critical thinking. Please review Box 20-1, Evidence-Based Practice, Missed Care, as a supplement to this PowerPoint. Care Plan Revision. If your patient meets a goal successfully, discontinue that part of the care plan. Unmet and partially met goals require you to continue intervention. It also may be appropriate to modify or add nursing diagnoses for a new plan of care with appropriate goals, expected outcomes, and interventions. An important step in critical thinking is knowing how a patient is progressing and how problems resolve, change, or worsen. After you determine that expected outcomes and goals have been met, confirm this evaluation with the patient when possible. If you and the patient agree, discontinue that part of the care plan. When goals and outcomes are not met, identify the factors that interfere with their achievement. Usually a change in a patient's condition, needs, or abilities makes alteration of the care plan necessary. At times a lack of goal achievement results from an error in nursing judgment, or failure to follow each step of the nursing process. Always remember the possibility of overlooking or misjudging something. When a goal is not met, no matter what the reason, repeat the nursing process sequence for that nursing diagnosis. A complete reassessment of patient factors relating to an existing nursing diagnosis and etiology is necessary when modifying a plan. Apply critical thinking while comparing new data about a patient's condition with previously assessed information. Sort, validate, and cluster all new data to analyze and interpret differences from the original database. Sometimes redefining a diagnosis may be necessary. After reassessment, determine which nursing diagnoses are accurate for the situation. Ask yourself whether you selected the correct diagnosis, and if the etiological factor is accurate and current. Then revise the problem list to reflect the patient's changed status. Sometimes you form a new diagnosis, or the prioritizing of diagnoses change. You base your nursing care on an accurate list of nursing diagnoses. Accuracy is more important than the number of diagnoses selected. As a patient's condition changes, the diagnoses also change. When revising a care plan, review the goals and expected outcomes for necessary changes. Examine the appropriateness of goals for any unchanged nursing diagnoses, and remember that a change in one healthcare problem sometimes affects the goals for others. The evaluation of interventions examines two factors: 1. The appropriateness of the intervention selected, and 2. The correct application of the intervention. Appropriateness is based on the standard of care for a patient's health problem. A standard of care is the minimum level of care accepted to ensure high quality of care to patients. Increasing or decreasing the frequency of interventions is another approach to ensure appropriate application of an intervention. Oftentimes during the evaluation phase, you may find that some planned interventions are designed for an inappropriate level of nursing care. If this occurs, you may need to change the level of care, substitute a different action verb such as assist in place of provide, or demonstrate in place of instruct. Evaluation is continuous, occurring through each step of the nursing process. Be sure to document all modifications or changes in care. Time for a quick quiz. Your patient has met the goal set for improvement of ambulatory status. You would now do which of the following? A. Modify the care plan. B. Discontinue the care plan. C. Create a new nursing diagnosis that states goals have been met. Or D. Reassess the patient's response to care and evaluate the implementation step of the nursing process. The answer is B. When goals are met, the care plan for that goal is discontinued. Standards for evaluation. Nursing care helps patients to resolve actual health problems, prevent potential problems, and maintain a healthy state. The evaluation process is an integral step in achieving these goals. A nurse must respect the patient and family as core members of the healthcare team, meaning that the patient and family must be actively involved in the evaluation process. The American Nurses Association defines standards of professional nursing practice, which include standards for the evaluation step of the nursing process. The standards define the duties that all registered nurses are expected to perform competently. When evaluating, be systematic and use criteria-based evaluative measures. Collaborate with patients and other professionals as appropriate. Use ongoing assessment data to revise the care plan for the best results. Clearly communicate the results of the plan to your patients and their families. It is important to ensure that only appropriate interventions are used with each patient. Case study continued. Miyoko determines the patient outcomes for Mr. Mashoud based on his reaction to the medication regimen. Question: which of the following is an end result that translates into observable patient's behaviors that are measurable and desirable? A. Unexpected outcome. B. Expected outcome. C. Sensitive outcome. Or D. Accomplished outcome. The answer is B. When a nurse has an expected outcome established, it means that it is measurable. If the patient does not meet that outcome, the nurse should reassess and modify the care plan. Patient-centered care is only achieved when a patient and family are actively involved in the evaluation process. It is essential for nurses to collaborate closely with all members of the healthcare team during evaluation. Members of the healthcare team who contribute to the patient's care should also gather evaluative findings. Communicating openly and on a regular basis with the healthcare team improves the likelihood of staying informed about a patient's responses to care. Proper evaluation determines the effectiveness of nursing interventions. It is also important to evaluate whether each patient reaches a level of wellness or recovery that the healthcare team and patient established in the goals of the care plan. In addition, you should ask yourself if you have met the patient's expectations of care. Additionally, documentation and reporting are important parts of evaluation because it is crucial to share information about a patient's progress and current status. All documentation must be accurate. The use of nursing diagnostic language, as well as nursing interventions classification and nursing outcome classification, is becoming more common in electronic medical records, thus improving the quality, consistency, and accuracy of what is documented. When documenting a patient's response to your interventions, describe the interventions, the evaluative measures used, the outcomes achieved, and the continued plan of care. Your aim in documenting is to present a clear argument from the evaluative data as to whether a patient is progressing or not. One of the ANA standards for evaluation is to share results of care with patients and their families, according to federal and state regulations. Case study continued. Miyoko follows which steps to objectively evaluate the degree of success in achieving outcomes of care for Mr. Mashoud. Please select all that apply. A. Identify the exact desired patient's behavior. B. Evaluate the patient's actual behavior. C. Compare the outcome criteria with the actual behavior. D. Assess the desired behavior and anticipated outcome. N. Or E. Judge the degree of agreement between the outcome criteria and the actual behavior. The answer is A, B, C, and E. To objectively evaluate the degree of success in achieving outcomes of care, perform the following steps. 1. Examine the outcome criteria to identify the exact desired patient's behavior or response. 2. Evaluate the patient's actual behavior or response. 3. Compare the established outcome criteria with the actual behavior or response. 4. Judge the degree of agreement between the outcome criteria and the actual behavior or response. And 5. If there is no agreement, or only partial agreement, between the outcome criteria and the actual behavior or response, identify the barriers and the rationale for the barriers. Time for one last quick quiz. You have finished with several nursing interventions. To evaluate interventions, you need to examine which of the following: A. Appropriateness of the interventions, and the correct application of the implementation process. B. Nursing diagnoses to ensure that they are not medical diagnoses. C. Care planning process for errors in other healthcare team members' judgments. Or D. Interventions of each nurse to enable the nurse manager to correctly evaluate performance. The answer is A. When evaluating, the nurse needs to look at the patient's condition, the interventions used to improve the patient's status, and whether or not they were appropriate.